Hello everyone, welcome back to Phương Viva Vivu channel. Today we have a very special guest, Dr. Stephen Marsh, who is a primary care physician in the US. And the topic of today is what to do when you are sick and need to see a doctor. So hello Dr. Marsh, maybe from now I'm gonna call you Stephen.
Yeah, that's fine.
And could you please introduce us about yourself and your experience as the primary care physician in the US?
Absolutely. Yeah, so as Fung said, my name is Dr. Stephen Marsh. I am a family medicine physician who practices primary care in the US. My experience, so I do a little bit of both hospital work and office work, as well as some urgent care work, so kind of a bit of everything. And so my experience is seeing both sick people and people who are doing well, and kind of obviously trying to figure out who needs what.
So what inspired you to be a primary care doctor?
Yeah, so I went to med school and I found that I liked nearly everything that I did in med school, like all the different rotations. And I'm someone who I think can get bored easily, and so I wanted something that kind of has pieces of each field of medicine in it and can allow me to both kind of coordinate someone's healthcare as well as also play detective sometimes when I need to figure out what's going on. So that means figuring out if someone, if someone's been losing weight, are they having cancer, are they having some other illness, and trying to diagnose that so that I can get them to the proper care that they need.
That sounds really nice.
Yeah.
So back to the topic of today.
Okay.
What to do when you are sick.
Mm-hmm.
So what would be your first advice if everyone feels sick, and what the first thing they should think about?
Yeah. So I think this can be tough as a lay person, but in general, the first thing when you're feeling sick is trying to figure out if it's an emergency or not. That can be difficult to decide, but there are some clear things. So for example, if anyone's having signs of a stroke, so you may have heard of the acronym FAST, or F-A-S-T, face, arm, speech, and then time. And the whole idea is, like, if the person's having a droop to their face, if their speech is abnormal, if their arm is weak or numb, then you want to get an idea of when the last time they were normal, like last known well, and then get to the ER, because those are all signs of a stroke. Is it always going to be a stroke? No, but that is life-threatening and could result in paralysis or death. And so that's something where I cannot treat that in the office. That needs to go to the emergency room. Other clear signs of emergencies include things like a heart attack. So horrible chest pain, the worst chest pain of your life, your arm going kind of numb, as well as having the chest pain, or sweating, or having the pain going up to your neck or your jaw. Some people's heart attacks present differently. Women in particular can have different heart attacks, like the way it presents, and that's in part because the way we studied heart attacks were mostly in white men. And so as a result, not everyone's a white man. And so the signs of a heart attack can differ somewhat between sexes. Those are kind of my two big ones that I always tell people, those are things you should go straight to the emergency room for. Also, if you're losing your eyesight, like if you were seeing fine 1 minute and next minute your vision is going black, that could be something really serious, and I may not be able to treat that in the office. So those are some three, I'd say, key clear emergencies that you should go to the emergency room for.
So, and what if we don't experience those extreme symptoms? We just feel like something that we need like to be cared immediately. We have some pain, some very severe extreme pains in some part of our bodies.
Mm-hmm.
Where should we consider to go?
Yeah, so pain is another good example. I'm glad you brought that up. So most pain we probably can treat in the office. We probably can evaluate in the office. Sometimes, I didn't include this in the list of emergencies, sometimes pains can also be an emergency. Like if you're having really, really bad pain in your belly, that could be a sign of appendicitis. And that I also can't treat in the office, unfortunately. But some other pains could also just be, you hurt yourself at work, you slept the wrong way, your body doesn't like you that day, and you probably can be seen in the office and we can treat you. So for things that are not clearly emergencies, the first thing you can do is actually calling your doctor's office, like wherever you see your primary care provider, because they may have some openings in their schedule, either with your PCP, your primary care physician slash provider, or with one of their colleagues that can see you. And this way you don't even have to think about trying to find somewhere else to go, because they'll know you there. After you've called them, if they have no openings or you can't get through, the other option is finding a nearby urgent care. Some offices, like the office that I work at, the urgent care is actually integrated into the practice itself. Like it may be on a separate floor, but it usually may have like doctors of that same practice. Other places are standalone urgent care centers, which may not know anything about you, because the healthcare system is, we all use different electronic medical records. But if it's something simple, like having pain or having a cough or a cold, or you need a doctor's note, then an urgent care can be a really good use of your time.
So from what you said, it seems like urgent care can be a better option if you don't experience something similar like stroke. But can you also provide some, maybe a list of some examples that help us to decide if we should even not consider urgent care and go to emergency care immediately, or something like we can just go there to urgent care first and then maybe you can decide later?
Yeah, so I think what you're alluding to is like, how do we as healthcare providers know when we're seeing you in the office if something can be treated there, or if it really is an emergency and it has to go to the ER. And so sometimes we don't know, and so we have to evaluate you. We have to look at, like, we'll check your vital signs, we'll examine you, and sometimes for example, I may see something on a person that I think, oh no, this is serious. Like, they probably can't just be treated at home. They need to go to the emergency room. So that's in medicine, we use the term triaging. I think it's probably used in some other fields as well. And triaging just is like using the information you have, like looking at the person in front of you, the patient, and all the other data that you have available to determine what level of healthcare do they need. Can they be managed in the office, like for urgent care or primary care? Or do they need to go to the emergency room to get more serious, like involved care, like special tests, getting procedures done, possibly even getting surgery, depending on what they're coming in with.
So for urgent care, what else as a patient that we have to consider where to go to? I assume that it might not be something that as severe as emergency care. So we get to decide what hospital we want to go, where we prefer to go. What would be your advice to where to go for urgent care?
Yeah, so I think for urgent care, like I said, if you, so this is, once again, assuming that you've called your doctor's office and that there's no openings. So like, two things. One, finding someplace that's close to you, ideally. But two, and this is the frustrating part, is you probably need to look at your insurance and find out what's in network, because you don't want to go to a place that's not in your insurance network and then get a huge bill. Other than that, there's not really too much to have to decide. I think it's, can you get there in a safe and timely manner? And are you going to pay an exorbitant bill, or is this going to be covered, at least in part, by your insurance? Urgent cares are nice in that they don't cost as much as going to the emergency room. So usually most urgent cares get billed as like a doctor's office visit when you go there. If they're doing other special things, like giving you fluids through like an IV, or maybe doing some other blood tests or things, that could then maybe add to your bill, but it's still not as much as an emergency room. And like I said, those things, if you're going to a place that's already in network, you're probably not going to have to worry about that. That being said, when we're sick, sometimes we're in a rush. We don't necessarily have time to sit down and open our computer or open our phone and look up and open our insurance website and figure out exactly what place is best to go to. So, you know, I mean, use your best judgment, but in general, if something's not life-threatening, urgent care or your doctor's office is usually a great place to go, because you're getting what you need without hopefully waiting for hours and hours and getting a huge bill.
That's really good to know. And how about the difference in terms of the wait time between urgent care and emergency care?
It may depend on where you're going. So like at the urgent care where I work, if you don't get there early in the morning, sometimes you're waiting for 2-3 hours, maybe longer sometimes. The ER, especially nowadays, now that the pandemic has receded to some degree, like it's not over, I guess, but some people are waiting 10 hours, 12 hours. It may depend. If you're going for a serious life-threatening emergency, like a stroke or a heart attack, they'll probably see you sooner, because if they don't, you could have some very bad outcomes. But if you're going there for a headache and they're not sure, it doesn't seem like the headache is life-threatening, you could be sitting there for hours, like many hours.
And so as a patient, to prepare for the trip to urgent care, what would be your advice for us? I assume that because it's urgent care, we don't need to make appointment, but what else do we have to consider to bring or to prepare to talk with the doctor?
I think in general, like I said, since most urgent cares may not always be associated with your primary care physician or provider, so they may not have all your records. So in general, I think good things to bring with you to any doctor's visit is a list of any medications that you're on, your insurance card, so this way they don't make you do a huge bill. Those are the two big things. And if you happen to have a list of any of health conditions that you do have. And lastly, what's really helpful if you're even mildly tech savvy, is you can usually download the patient portal app for different healthcare sites on your phone, and that should have a link to all your health information from your primary care provider's office. So for example, where I work, we use Epic, which I think a lot of places are using these days. And Epic, at least for my institution, has something called MyChart, which is just a patient portal. That's what its brand name is, MyChart. And in it has your list of medications, it has your allergies, it has your health issues. You also have access to your recent doctor's visits and your notes and your labs. So I find that really helpful to have, because if you're going someplace that no one knows who you are, they're going to ask you, do you have any allergies? What medications are you on? If you're on a lot of medications, that can be hard to remember. So it's nice to either have a list written out, or to have the MyChart available, like a patient portal, so you can show them and be like, oh yeah, I'm on this, 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 and this. Because sometimes things we try to prescribe will interact with someone's medications, or they could be not the best medicine to use if someone has a certain health condition, or if someone has a certain allergy, or not even an allergy, but like a bad reaction to a medicine. Because not everything that people have a reaction to is truly an allergy as defined by medicine, but rather just a side effect or a bad reaction.
So that is before the urgent care visit. And now if after the urgent care visit, and assuming that we are going to the place that is not where our primary care doctor is, what should we ask the urgent care doctor for any information, or how it's going to work to transfer the record of what we have today to our current primary care doctor?
Yeah, it's a great question. So I think it depends. Once again, some urgent care places you go to may use a similar form of the electronic medical record that your office does, in which case sometimes they can communicate. It's not always 100% clear. You're not going to know that necessarily when you go. Sorry, excuse me. The other thing is you can have them print out a summary of your visit from that day. The summary of your visit from that day does not include the doctor's note. That just includes like any instructions that they're giving you. It includes what tests that they did, but it won't have the results. It'll include any medicines that they prescribed. It'll include any diagnoses that they put down. Like if you're going for a cold and they say, oh, actually you have bronchitis, the summary will say, you were treated today for bronchitis. We prescribed these medicines for you. This is the pharmacy that you plan on picking them up at. These are the tests we ordered, if we ordered any, and so on and so forth.
So also from your perspective as a primary care physician, what would be the challenges for you to direct the patients to the appropriate level of care?
Yeah, so I think one of the big challenge is just knowing when someone's actually sick, because people can present differently. As I mentioned earlier in the video, the signs of a heart attack in a man can be different than in a woman. And so kind of being, keeping an open mind when you're evaluating someone and thinking about what are the things that we as a physician or a healthcare provider cannot miss, because if we do miss, that could result in a really bad outcome. You know, doing a thorough exam, your due diligence, looking over past lab results if you have any of that information available. And then I think a lot of us in the healthcare field are tend to live by the idea that, you know, if you're ever unsure or you're worried about someone, it's safer to send them than not to send them, because if you send them and they wait but everything's fine, you're like, okay, this is good. If you don't send them and something bad happens, like God forbid they die, or they have a permanent disability as a result of you not sending them to the ER, that's going to sit with you for the rest of your life.
So another question is more for me, because I'm living in Boston and I don't have much experience living in other cities, other states of the US. So I'm wondering what the healthcare system in the US, the Boston, as you were describing, is it similar, or is there any difference from other cities or states of the US?
So I can't speak to that fully, as I've only ever really lived in New York and in Boston. But for the most part, a lot of things across the US are somewhat similar. So when I say that, I mean like a lot of places in the US will have primary care offices, urgent care centers, emergency rooms affiliated with hospitals, and so on and so forth. There are probably some state by state variations. Some states, for example, may not have such a robust health safety net, and what I mean by that is ways to take care of people who are underinsured or uninsured. Massachusetts prides itself on being a state that has a really good safety net. That actually was started back, I think in 2008 or 2006 by Mitt Romney back when he was governor, kind of making sure that every person in the state could have some form of health insurance to at least to cover for catastrophic care, like going to the emergency room, as well as covering for other things. Some of those same components were then continued into what all of us call Obamacare, or the Affordable Care Act. So yeah, there are some state-by-state variations, but I think in general there's a consensus that there's primary care offices, some urgent care centers, and emergency rooms.
So let's move on to another topic. How
Okay.
do you think about the urgent care fit into the larger healthcare system in the US?
Yeah, that's a great question. So I think urgent cares, kind of as we've been talking about this for this whole video, urgent cares are kind of the midway point in the healthcare system between when you're well, which is going to for your routine visits, your annual checkup, things with your doctor, and emergency rooms where you're going mostly for emergencies or when you're really sick. So urgent care is that midway point where you can go see someone when you're sick, but not too sick, getting like a doctor's note, getting treated for like a cold, getting treated for some other illnesses that are not life-threatening. So like they're this helpful part of our healthcare system that allows you to not wait as long as the ER and still get good care.
So how do you think the roles of urgent care can evolve in the future?
Yeah. So I think, as I mentioned earlier in the video about the Affordable Care Act, also known as Obamacare, I think the future of healthcare, for better or worse, is that we're trying to cut healthcare costs and also cap the healthcare costs. So healthcare costs are one of the biggest expenditures for our GDP, if I remember correctly, our gross domestic product. And so we spend a lot of our money in this country on healthcare, probably both taxpayer money and individual money. And so the goal of trying to cut costs and really involve to involve urgent cares more in the healthcare system is really by almost rewarding us as patients for seeking out lower cost care. So trying to really reserve the emergency room for only like life-threatening serious conditions, and trying to use our doctor's office and our urgent cares for things that are less serious and that also still need to be taken care of. As I mentioned earlier in the video, usually, and this may not be every single urgent care, but most urgent cares are billing you similar to the way they bill a doctor's office visit. And so this decreases costs both to you as a patient and decreases costs to the insurance companies and so on and so forth. Because when the costs go up for both of us, both the patient and the insurance companies, then some of that cost is then passed back on to us as patients. One of the ways that Obamacare, I think, is also trying to do this via healthcare policy is by having more high deductible healthcare insurance plans. And so what I mean by high deductible is that after you've paid your premium, you have a certain amount of money that you have to pay that is deducted from the healthcare costs, at which point then the insurance company will start paying. Some things are covered before you get to your deductible, like your annual well visits usually are covered, but some things are not covered. And so it's helpful to know, especially if you are getting a high deductible plan, that you are seeking out things that still the best care for yourself, but also things that also are hopefully not costing you too much either. The high deductible plans, they may be something you've bought on the healthcare exchange, which starts if people need to buy health insurance because their job's not offering health insurance, or some jobs are now also offering high deductible plans.
That sounds very promising, and I hope urgent care can be one of the best supporting systems for the patient who need care immediately. So to conclude the interview, what would be your one key piece of advice for patients to decide between urgent care and emergency care?
Yes, so as we said in the beginning, it can be really hard as a layperson to know when something's an emergency versus not an emergency. Some things, like, as we said, are pretty easy. If you have a cold, you just have a mild pain, something, those are usually non-emergencies. But yeah, sometimes when you're having like some pain in your chest, it's like, is this gas? Is this acid reflux? Or is this a heart attack? And you don't always know as a patient. And so, as I'm sure everyone here has heard, when you've called your doctor's office or tried to call somewhere else, you may hear that initial line that they say, where if you are having a medical emergency, please hang up and dial 911. So in general, if you're ever really, really worried about what you're experiencing, you think this could be life-threatening, then it's safer for you to go to the emergency room, because there they can assess you and determine if it is an emergency or not and get you the care that you need. The other option, if you're not sure if it's an emergency but you know that you're sick, is actually still calling your doctor's office or going to an urgent care, because then we as healthcare providers can triage you to the appropriate care level, either treating you at the urgent care or sending you to the emergency room. So I think in general, if you're really, really worried, you're having symptoms of a stroke, symptoms of a heart attack, go straight to the ER. If you are really, really worried and like you don't know about where the nearest urgent care is, or you think that this could be something serious, it's better to err on the side of caution, because it's we don't want anyone to be getting hurt while they're trying to figure out, is this an emergency or not an emergency. But if you feel like you're probably not having an emergency and you're overall doing okay, urgent care is a great option.
So how can patients better educate themselves about the appropriate use of urgent care and emergency care?
Yeah. So I think for patients in general, one way to educate yourself is always just, if you can, try and call your doctor's office if you have a doctor, because the people who answer the phone, if you can get on the phone with a nurse or another healthcare provider, they can help you decide where you should be seen. You know, there are, the internet is out there, things like WebMD and Google search. I don't recommend those personally because usually you type in even very mild symptoms, and one of the answers that it comes up with is cancer. So, but if you feel like you want to try and look something up, you can, just knowing that the internet tends to give you every available option, which can include some serious emergencies. But yeah, call your doctor's office, see what they say, and kind of go from there.
Thank you, Stephen. And that will be the end of our interview. So we are hoping to make more videos about healthcare system and medicine here. And if you have any questions, feel free to put in the comments, and we're happy to answer that. See you in the next video.
Bye bye.